Now, your health, your safety. This is ABC7 News.
All right, welcome. We made it to Friday. I'm Kristen Z. Welcome to our daily special called Getting Answers. We're asking experts your question every day at 3 o'clock to get answers for you in real time. Today, we're answering your employment-related questions and sharing some insight on the current job market and who is hiring. So you can post your questions on our Facebook live stream, YouTube Live, or check out our Instagram stories to submit a question. But first, we're all talking about masks right now, right? How to protect yourself now that the CDC is telling us to always wear a face covering when we're out in public. So we're going to teach you how to make a mask in less than 2 minutes. I'm really excited about this because joining us today is Jeremy Howard, a research scientist from the University of San Francisco. Jeremy, you've been talking about masks for, the past 6 weeks or more, right?
Right.
And now that we're finally adopting this on a more universal basis, I want to get to it. I'm really excited to show people how quickly it can be done. But before we get to that, I know you've also been studying it as a scientist in terms of the impact if people all wore masks, and you have the results of a new study. So tell us about that.
Well, thanks very much. So, yeah, since I was last on your show over the last week, I've actually put together a team of 18 of the top world experts from all around the world, South Africa, Europe, China, and we've been studying the data and the literature intensely. And what we've discovered is that people actually have their masks backwards, or maybe we could say inside out. Nearly all of the research has been looking at what's the impact when you wear a mask in terms of, do you get sick? Do you get infected if you're wearing a mask? Turns out actually what masks do is they stop other people from getting sick if you're sick. And remember, you don't know if you're sick. You're actually most infectious at the time that you've just first been infected. So we've crunched the numbers, and it turns out that under some pretty conservative assumptions, getting everybody to wear a mask could cut this magic number everybody's been talking about, the R or the R0, down beneath 1. That would actually stop the spread of the illness. And modeling suggests that that could be worth many, many thousands of dollars per mask per person. So this is such a big deal that now, for example, Los Angeles has actually told everybody in the city, you have to wear a mask because this is like a public health issue. We now know that masks are best used when somebody who might be infected wears it. So if you go out to the shops and somebody there is not wearing a mask, they could kill you. So that's basically what we found. It's a really, really important issue.
What do you mean by thousands of person per mask? Are you talking about savings in terms of healthcare?
It's not even that. It's so I'll quote it for you. It's from a Yale study, which we actually, as part of the research we looked at. It says that, I've got a quote, epidemiological models suggest that hundreds of thousands of deaths could be prevented globally if we wore these masks, creating trillions of dollars in economic value. According to one commonly used model, a 10% reduction in transmission probability would be $3,000 to $6,000 per capita from reduced mortality risk. And that's before we even take account of the fact that we actually get our economy going faster. And by the way, our research suggests that the reduction in risk, the transmission probability would be even better than that.
Okay, so now that we know why it's important for us to wear masks, or as many people as possible, or I should say face covering, let's get to making it, because I didn't realize it would be that easy. I mean, I'm not someone who sews, so the idea was intimidating to me, but we're going to go through a couple methods that require no sewing.
Great.
I'm ready.
Okay, which one do you want to do first?
How about the bandana?
Okay, sure thing. So you got one there.
I do.
So what you want to do is go to our website, masksforall.co. That's the number 4, masksforall.co, and there's a diagram and a video of 2 recipes. So the first one is the bandana. So what you want to do is fold it over. Yep. You know the deal.
I know the deal.
I don't know if you've got any paper towel there, but if you do, you could slip a paper towel in before you do that fold.
Yeah, I do.
Oh, great.
Okay.
So just pop it in the middle before you fold. The reason for that is that the way this infection spreads is tiny droplets when you speak and breathe, and that paper towel is going to absorb them better.
Got it. And I got my hair bands ready.
Okay, great. So you can pop them on a third of the way down each side.
All right, there's one.
I watched you doing this in the commercial break, so I know that you're good to go. There's no stress at all.
You got to be fast. Life hacks, you know?
So then
I got my
you want to fold. Great. Fold one side in.
Yep.
And then fold the other side into the little flap.
Okay. Not totally graceful right now, but that's okay.
good to go.
Yep.
All
There
right,
we
so
go.
this is actually scientifically proven, this mask. The cotton that's been found by Cambridge researchers does a great job of blocking the droplets. And as I mentioned, the paper towel actually absorbs them. So this is going to keep everybody safe. It's also going to keep you safer as well.
I need my daughter's bigger hair bands because these are a little short for me, but I get the
Yeah, you
picture.
can also use rubber bands, but they're a little less comfortable.
So that's the quick one. Now we got a t-shirt one, which is also quick. It's 2 minutes instead of one.
Also quick. Yep. So so I've got the so there's actually the pattern for this is on our website, but basically you end up with this kind of a look.
Okay, you talk us through it while I cut. How's that? I've
Sure.
got scissors.
And so and what we then do is I just put a little safety pin at the bottom. And that means that when I put the piece of paper towel in, it won't fall all the way through.
Okay.
And so the key thing, I've got a handheld mic, so I can't show the tying it up.
Okay.
But basically, this fits really nicely. It actually gives you a better covering than the handkerchief.
Okay, so
version.
far I've cut the t-shirt, so it's like this.
Great.
And then I'm going to
Great.
cut
And so
the
then you cut
sleeves,
the-
right?
Yep, cut the sleeves out.
Okay, while I cut as quickly as I can you explain how to cut the sleeves?
Great. So you cut kind of along inside the top edge of the sleeve and inside the bottom edge of the sleeve, and that's going to give you straps on each side. So this is quite a nifty approach because you get a really good.
So there. I
you
cut
are
this little
fast.
part out.
You're way
right?
faster than me.
Okay, so you know what? I did one in advance, so I did both sleeves. So we end up
can you
with
show the
this.
tying here because you're at a proper desk? So the top, that's it. So around over the top of your nose, and then the top goes behind your head a little bit down, so it's kind of sitting nice and low.
Like low.
And then the bottom straps all the way back over the top. And what
This
that
part
does
over
is
the
it
top?
creates. No, actually underneath your chin. So go underneath your chin.
Oh,
Okay, round,
like
and then all the
this.
way up. If you've got a ponytail, it will go over the ponytail.
Okay.
And so it's kind of giving you a nice cover all the way around your chin.
Okay. I don't know if folks can see that. How's that?
Yeah, it's not bad. I would do it higher up in the back there, but it's good enough.
Okay.
Yeah, no, that looks great. So again, with that one, you can put that piece of paper towel between the two pieces, and I'll show you a new trick, which I actually literally thought of about 10 minutes ago and tried before I went on air, and it worked great.
Okay.
This is the Jeremy's mother-in-law mask, which is a bit more stylish than you and I have done.
Oh my gosh, that's nice. She
But,
sewed
it's
that.
still just she sewed that. She's doing it for the whole community. It's fantastic, including my 4-year-old daughter, who will not be seen outside without her mask because she has to be like mama and dada. And what I got her to do here was to leave a little pocket, which we put the paper towel in. But here's the magic trick. If you want to protect yourself better, it's good to have a better fit around the nose. And so what I did just before I went on air was I got a piece of aluminium foil, or as you Americans would say, aluminum foil, sorry, and folded it all up like so. And then if I put this into the top, then it actually creates a nice tight fit around the nose.
I see.
And that nose piece is the thing that helps to keep you more safe so
What a
that you
great
don't kind of
idea.
inhale droplets.
Hey, Jeremy, one quick question from our viewer. Does a coffee filter work as well as a paper towel?
Yes, they're both great. The thing I've seen studied under an electron microscope is the paper towel, but coffee filters seem pretty similar, so I'm sure that would be fine.
All right. Jeremy Howard, great information, and those videos are right up there on your website, maskforall.co, right?
Yeah, the other thing I want to tell people about is, it's so important that this is not enough to protect yourself. You need the people around you to protect you, which means we need laws. And so if you want to learn about those laws and tell your governor, really our governor in California needs to be putting these laws in place, text Masks for All to 50409. That's 50409, and that will actually send a letter to your governor demanding these laws.
Right. I mean, we don't have a federal mandate right now, not a state mandate, but a lot of cities and counties are starting to mandate the mask on their own. So one step at a time. All right, Jeremy Howard, thank you so much. Good to see you.
Thank you.
All right, we've crammed a lot into this half hour. We're talking jobs as well, how the vaccine is made, and we're making art. We'll be back on air, but the conversation continues on all our live stream platforms right now. All right, and we are in break, folks, on Facebook. Yeah, did you see how quickly that went? I mean, granted, my cutting work is a little bit on the ugly side, but that's okay. I mean, in a pinch, it'll do. And if you have more time, if you go to their website, you really can follow along. The video makes it really easy to just see what they're doing there. And yeah, the paper towel is extra protection. If you want to put it in between the t-shirt layers, you can put that in there, and then you'll just want to put a little, I didn't get a chance to do this on air because I didn't have quite enough time, but you put a safety pin at the bottom, right? So you close that up so the paper towel layer doesn't fall out. So there you go. Super quickie DIY hack on how to make a face covering. And yeah, if you had a ponytail with that t-shirt method, it actually works really well because the ponytail serves to kind of hold the ties in place in the back. So I hope you enjoy that. And I definitely encourage you to check out Jeremy Howard's website. All right, now coming up, we've got an expert on jobs, because a lot of people certainly have been losing their jobs. And but who is hiring? Maybe you're looking for a part-time gig right now. You'll want to find out which companies are actually putting out the help wanted signs. So we'll talk about that in just a moment. In the meantime, I'm going to take a sip of water. Okay, keep those great questions coming. All right, wearing one like this already. Valentina Feldman, good. I'm glad you are wearing that already. All right. All right, here we go. We're coming back on air, and we have Dr. Patel's doctor's note. All right, C7? All right. All right, we are now able to bring you even more content now that we have this new platform at 3 every day. That means we get a daily doctor's note from our special correspondent, Dr. Alok Patel. He's part of our coronavirus team of experts. Every day, he's going to talk directly to you about a topic regarding COVID-19. This one is forward-looking.
I'm Dr. Alok Patel. A lot of people have been asking me, how exactly does a vaccine go from a research lab to protecting us against coronavirus in 12 to 18 months? Well, let's talk about it on today's doctor's note. So quick background. Vaccines protect us against various viruses and bacteria. It's like showing your immune system the enemy's playbook. You get a vaccine, you build up antibodies, and then if you ever see that foreign invader again, your body's already prepared. Right now, there are over 40 different vaccine prototypes for COVID-19 in different stages of development. Here's a brief overview of the process. First, scientists figure out the best way to make a vaccine in a lab, and if their idea is approved, they move on to phase 1 trials to make sure the vaccine is safe. Phase 2 trials are to make sure the vaccine creates a good immune response, is still safe, and can be manufactured on a large scale. Phase 3 trials can involve thousands of people, collect a lot of data, to make sure the vaccine prevents the specific disease in question. Now, this is a long, complicated process that could take years. And for the vaccines that even make it this far, it's still not over, because at this point, the FDA reviews all the data before giving the vaccine the final stamp of approval. Now, we're living in unprecedented times, and there's an incredible collaboration of scientists all over the world, so the timeline of getting a vaccine is accelerated. We first learned of the genetic material of this virus in January, and we're already in phase 1 trials for one vaccine prototype. That's 3 months, lightning fast. And that's why we're hopeful we'll see a vaccine in a little bit over a year. But keep in mind, even at this speed, there's still a lot of really close monitoring of the process to make sure we see a quality, safe, life-saving vaccine. Science is awesome.
All right, that's our doctor's note from Dr. Alok Patel. We're taking a quick break on air, but the conversation continues on our live streaming platforms right now. All right, folks, we are going to have a couple of interesting segments coming up. One of them is the fact that charities have been really hit hard. And one of my favorite charities, Kids in Art, they do workshops for pediatric cancer patients, and they haven't been able to do it in person due to shelter in place. But they didn't want the children to not have that outlet. So they've kind of come up with a creative way to deal with that and continue to offer their inspirational workshops. And I'm going to show you how. In fact, we're going to join a workshop in progress, which is super exciting. I can't wait to see what they've done with that. So let me just get ready for that interview. I want to check out some of your viewer comments here. Rose Hildes said, thank you for these ideas for making masks. You're so welcome. That's where we're all here for, to explore different ideas together. And I'm glad you enjoy that. And let me know how yours turns out. Just post it on my Facebook page and post a picture of you wearing your mask even, and we can all share ideas. Let's see. Richard Avery says, no matter what type of mask I use, it fogs up my glasses when I exhale. Oh, yes, this is an issue. Do you have contacts? Does that help? Oh, look, one of our engineers here has got glasses as well.
Anti-fogging lens cleaner.
Anti-fogging glass cleaner, lens cleaner. Okay, that's what he uses. Are you allowed to appear on TV? Can you say hi? Like, just show people what, you've got glasses. Like, see? Oh, wait, no, we didn't see you there, Dave. Okay, anti-fogging products, they exist. So check that out. Richard, glad you posted. Hope that helps you out. All right, we are able to bring you even more content now that we have this new platform at 3 o'clock every day. Hope you're joining me. That means we get a daily more content, including the latest news. And today we talked about some COVID-19 issues related to the city of San Francisco and the state of California. Phil Matier, our contributor, definitely had some thoughts on Midday Live today.
So let's start with Mayor Breed, Phil. Yeah. She's obviously received a lot of accolades for the way that she's handled COVID-19, including being the first mayor to order essentially a shutdown in her city. But she's also received some criticism as of late, especially when it comes to handling the homeless. Where are we now with this issue?
You know, it's really difficult, Reg, and I got to say, even before the pandemic, San Francisco and criticism of the mayor over handling of the homeless was a regular and routine issue. It's a difficult population and one that its health needs are very unique. It's not just the coronavirus that people are worried about. It's also addiction, mental health, and several others. But the bottom line is that the program and the plan has been shifting daily, almost hourly when it comes to this population. For a while there, they were talking about putting them in cot situations like you're seeing there. But it was determined that they would be too close together. Plus, it just wasn't a good look to have people sort of laid out. So the convention center, that's not going to be having as many people as they thought they would. At the same time, they've got to get the people that are infected and others out of shelters. As a matter of fact, there was a report this morning out of City Hall that there has been another outbreak in one of the shelters. I think they'll be addressing that at the 1 o'clock press conference. But the bottom line is the situation has been shifting hourly. The CDC issues different recommendations, and they've gone from let's get them out of the shelters into, say, a convention center to no, let's get them out of that and get them into hotel rooms. Okay, but at the same time, let's hand out tents so they can shelter in place wherever they are. It's a mixed bag, and it's changing regularly, and criticism goes with part of that.
I mean, in all fairness, the argument that some are making that, hey, all the homeless need to have their own hotel rooms, that's the safest way, as opposed to using, say, the Moscone Center or Palace of Fine Arts. What about the argument the mayor's making that, hey, we got to save some of those hotel rooms for, frontline workers, healthcare workers?
We do, and
the
it
elderly.
has to be split by that. So there's a political angle to this as well. There are homeless advocates that say that people shouldn't be on the streets anyway, and they should be in hotel rooms, and they're going to, you'll be seeing movements like this to get them in there. But you're absolutely right, Kristen. I mean, there are several other needs out there, and the cost of it, and not every hotel wants to double up as a homeless shelter. All of this has to be figured in. It's not a perfect world. It's not a perfect situation. And when you're dealing with something like this, the cost also is pretty high. They're talking those hotel rooms are going for $197 a night. So all of that has got to be, you don't wave a wand and everything work out. So it leads to confusion, leads to criticisms, and back and forth.
Well, Phil, what about, I want to turn our attention now to ventilators, right? Governor Newsom has loaned out ventilators, I think 500 to New Jersey and also some earlier to New York. We're hearing some here in California, Riverside County, for example, saying, hey, we need them here. And in Santa Clara County, some officials there are saying, look, we're okay right now, but we could need hundreds more when we hit our peak. So how does that play out for him politically?
That remains to be seen, but you've hit on another one of the paradoxes that we're all covering is mixed messages between different agencies, between the state and the locals. Like you said, Riverside says they need ventilators. Gavin Newsom says we've got a surplus and we can actually put them in the national stockpile for dispersal to other places, but maybe bring them back. Santa Clara put out a bounty for ventilators, saying that they'd be willing to pay up to $1,000 for even ventilators if it's broken and they can get it fixed, because they're looking at a shortage of a couple of hundred should there be a peak in May. Now, here's the issue. The issue is everybody's trying to prime up for a surge or a peak in May. But between now and then, the governor's saying we can maybe lend some out to other parts of the country that need them. And then the county officials say, okay, let's say you've lent them out to New York or New Jersey. How do we get them back? How do they come back? How do they stop being used? All of this is swirling around. I think there's people in Santa Clara, they, like I said, they put out the bounty for the ventilators, and somebody asked them, well, what about the stuff from the state? It's a confusing thing, and Riverside is not happy about it because they say they need ventilators. The question is, can they get them back in time for that? That's the goal. We're going to be seeing, like I said, a lot of this. We report it, and then you kind of check against what's the reaction and how it's playing out, and that takes time. And I've got to tell you, even reporting this is getting more difficult because a lot of times there's not necessarily somebody on the other end of the phone when you're calling around to these different agencies and such looking for answers.
All right, that was our conversation with Phil Matier earlier today on Midday Live. By the way, since that conversation, we've learned, you heard us talking about the issue of the homeless and how to shelter them safely in San Francisco during the pandemic. Since then, we've learned that the mayor announced there's been a coronavirus outbreak at the city's largest homeless shelter, MSC South, with 68 clients, the homeless who live there, and 2 staff members testing positive for a total of 70 people. So that's a mini outbreak right there. All right, we're going to take a quick break on air, but the conversation continues on all our live streaming platforms right now. All right, folks. Okay, very excited about the next segment because thanks for waiting. Our next segment is with a Bay Area charity that's done a lot of great work, Kids in Art, and they're going to show us how they're continuing their workshops right now during this really, really difficult time. And they've had to get creative, and this is all coming at a time when they're hard hit financially, like so many charities are. So I can't wait to check in with them. I will tell you that the founder started this organization because her own son had gone through cancer treatment. Eventually he passed away, but he was really into the art, and when he did the art while he was battling cancer, it really gave him so much hope and feelings of calm and love, and just it really was crucial in terms of that healing process for him. So she founded this charity, Kids in Art. It's been around in the Bay Area for over a decade now, and they've done great stuff. So ABC7 has actually featured them in a few stories in the past, an ABC7 star, because they just brought so much brightness and happiness to kids who are going through a very hard time. And I will note, it's not just the kids, it's their siblings, right? It's their families. And so having this art outlet is absolutely critical. All right, so we're gonna come back on air. Hang on for just a second while I get my scripts in gear. Okay, let's see, a few more comments. From Anita, I heard if you clean your glasses with shaving cream, your glasses will not fog up. Ooh, I don't wear glasses, so I don't know about that one, but let's ask Dave. Does that work? Have you ever tried shaving cream to clear up your lenses and make sure they don't fog up? All right. Hey, it's worth a try. I always say it's worth a try. If it doesn't work, move on to the next thing. All right, coming back on air. One sector that's been hit hard by the coronavirus pandemic is charities. Not only is their funding way down, but they're often unable to deliver their services that their clients depend on. So one Bay Area charity that's found a creative way to still do what they do is Kids and Art. The nonprofit brings art workshops to pediatric cancer patients. Joining us today is Kids and Art's Executive Director, Suzanne Yao. Great to see you, Suzanne.
Hi, Kristen. Lovely to see you again.
Always. You know, as you know, I've been involved with Kids in Art for half a dozen years now, since ABC7 featured the charity and its founder, Purvi Shah, as an ABC7 star. So I know very well what you guys normally do, and it's amazing. But for our viewers who are new to it, tell us what you normally do to support kids with cancer and their families.
Yes, absolutely. So at Kids in Art Foundation, our mission is to bring healing through art, healing for our pediatric oncology families, so the patients, the siblings, as you mentioned, anybody in the care circle. And we also really want to help support any other children that are touched by cancer. So if there's an adult in the family that has cancer, but typically we do these by hosting weekly art workshops at 2 major Bay Area children's hospitals. So we're usually at Stanford, Lucile Packard's Children's Hospital every week, and also at UCSF Mission Bay in San Francisco. And then once a month, we do what we call destination workshops, where we bring families, so kids that are less immunocompromised, to unique destinations to create art together and have a sense of community.
Yeah.
And so that's what we typically do.
Typically, of course, shelter in place and social distancing have made those workshops impossible. So I know you found a different way. In fact, it's happening right now as we speak, live. Thank you for the invitation to join in. Let's take a look, and you walk me through what's happening here.
Yes, so we decided that we still really wanted to create that sense of community and connection for all of our families, and also open it to all pediatric families in the Bay Area. And so this is a live workshop happening. You see our program managers there, as well as Parvi Shah, our founder.
Hi, Parvi.
And so they, right now, every week, we have a planned lesson, and we send the information out to all the people who register, and then all the families join into Zoom so that we can connect together, and they have all their materials ready, and essentially they are being guided through the lesson and they're creating art together. But it's also so wonderful because then they get to talk to one another and have that sense of connection while they're creating.
And that's amazing. And this lady right here is the instructor for today, right? And are they all volunteers? And I know they're all great artists.
Yeah, so the ones that are on the lesson today are our 2 other part-time staff members. We are a very small organization, so they're actually our program managers. But we typically, our organization runs on the power of volunteers. Volunteer artists come into our hospital workshops and design all these wonderful lessons and experiences. But the ones that are facilitating today are actually our program managers that are on our staff.
You know, why is it so important to keep up with art and have this outlet for kids battling cancer?
You know, at Kids in Art, we know the healing power of art. Art has the ability to help you deal with stress and anxiety, and in all that's happening in the world, not just for the pediatric oncology families, but stress that's new to them is so present. And so having expressive outlets like art, music, dance, it's just so empowering. And for our kids, being on isolation is actually familiar. They know what that is like. But still, they know that they work, they went through their treatments where they had to be isolated for long periods of time. And now they've been able to attend our workshops. And so to have this all of a sudden pause again, it's just, this is our way that we feel like we can still provide them connection and community is through these virtual art lessons.
Yeah, look at those little faces. They all look like they're having a great time and working so hard, concentrating. Hey, we've reported on many organizations canceling their fundraisers or just losing donors due to all the economic uncertainty right now. So how have you guys at Kids in Art been affected?
You're so right to say so many nonprofits and organizations, especially smaller ones like ours. We hear that there are these opportunities to support nonprofits, but we're such a small staff that we're focused on our families and really delivering programs to them. And so to be able to go out there and apply for, these different loans is just not in our capacity right now. Also, the grants we typically write for support our hospital workshops. And so we're really having to find new ways to find funding and support to just sustain and continue to connect our families.
Yeah, because you don't want to put a hold on what you do. These workshops clearly seem so important and vital. I'm wondering if you plan to hold more of these as long as we're in shelter in place, and how often, and how do kids join?
Yes, absolutely. We're going to do these workshops for as long as we're in shelter in place, and possibly even to continue afterwards, because this is a new area for us that we're finding works for a lot of people. And we're actually even in talks with the hospitals to see if we can do live workshops with the patients that are inpatient. And so that way they can participate while they're on isolation precautions or whatever it may be. Anyone can join, anybody that's in the pediatric oncology community, as well as any young adults and kids impacted by cancer. You can go to our website, and on the website's homepage, there is a direct link to how to register for our workshop every week.
All right, that is fantastic. Great work. I'm constantly impressed by what you guys do, the kids you serve, and the joy that you bring. Folks interested in learning more can get more information at kidsandart.org, or you can email art@kidsandart.org. I got that right, Suzanne?
That was perfect, Kristen. And thank you so much for your continued support and belief in our organization and what we do.
Oh, sending a virtual hug to all of you. Good luck.
Back to you. Thank you.
And thank you to the kids for letting us watch over their shoulders and see what they're doing today. That was great.
They were very excited.
Awesome. Hey, thank you so much for joining us today on this new interactive show, Getting Answers. We'll be here every day at 3 o'clock on air and on live stream answering your questions, Facebook Live, YouTube Live, ABC7news.com, and our ABC7 News app. Thanks for joining us. Have a great weekend.